Good morning. I'm calling to order this meeting of the Health, Environment, and Community Engagement Committee. Cam Gordon, I'm chair of the committee. This morning I'm joined by council members Andrew Johnson, who's vice chair of the committee, and Jacob Fry, Elizabeth Glidden, and Lisa Bender. Member Cano might be arriving at any time. Welcome back, everyone. This is our first meeting of 2017, and I look forward to a great year with lots of productive work. We have 9 items on this agenda. I'll go through the consent items first. There's 7 of those. If anybody wants to pull anything off, we can certainly do that and discuss them. The first consent item is an amendment to an agreement with the Center for Energy and Environment for Professional Building Benchmarking and Disclosure Services. This would authorize an amendment to a contract with CEE, increasing the contract up to an additional $70,000 and extending it through March 31st of 2018 to continue the work they've already been doing on our building benchmarking and disclosure services. Second item is various approvals to our Public Health Advisory Committee appointments. We'll be approving some council appointments for 2-year terms beginning January 1 this year and ending December 31st, 2018 for Amal Karam from Ward 3 and Kosar Mohammed, Ward 6. We're also approving council reappointments for 2-year terms for that same period of Akeisha Everett, Johanna Berry, Kathy Jasinski, Jane Auger, Yolanda Adams-Lee, Joseph Coliani. And that's it. The third item is authorizing an agreement with OMADA for online diabetes education services. The fourth item is authorizing submittal of a grant application to the Department of Housing and Urban Development. This is for $3.5 million for a 3-year period and would provide lead remediation and healthy home services for up to 300 homes of low-income residents. Fifth item is accepting a federal Department of Education funding grant from Wilder Research Center in the amount of $24,000 to participate in a study on intervention strategies at school-based clinics. Sixth item is accepting federal funding from the Department of Health in the amount of $1,534,194 for public health home visiting for low-income and at-risk families. And the last item is directing health department staff to move forward, working with the state on a variance process to allow dogs in some establishments. Would anyone like to pull any of those items off for discussion or any questions? Seeing none, then I will move all items on the consent agenda forward. All those in favor, please say aye.
Aye.
Any opposed? Those all are carried, and we'll move forward to the council for approval. Now we'll move into our discussion. We have 2 discussion items. The first has to do with a contract with Pillsbury United Communities to provide sexual health services for young men of color. I believe that we'll have maybe the health commissioner will kick this off, and then we'll hear a little bit more about it from staff.
Good morning.
Good morning.
Mr. Chair, members of the committee. I'm Gretchen Musicant, the Commissioner of Health for Minneapolis. And I'm just going to give you a brief background of a study that you heard about last April. It was presented to the council because it sets the stage for this grant, and yet also some of the recommendations of that study are not fully realized in this proposal. So as you might recall, we had 12 youth researchers who worked with Youth Prize, and they interviewed over 100 Minneapolis youth of color about healthy sexuality. I think it was a well-received presentation. What they found was that sexual health disparities, and there are significant disparities, which you'll see a little bit later in this presentation, are the result of systemic barriers related to race, inadequate sexual health education, and other negative social factors. They recommended both to the health department and to the city council that we increase our investment in non-clinical approaches to prevention, testing, and treatment with a targeted focus on young men of color. So following their recommendations, the health department did submit to the mayor a request for $200,000 for the 2017 budget, which she then in turn recommended a budget increase of $100,000 but unfortunately that request was not approved by the City Council in your final budget. So the contract being presented today by Nigel Perot, our Youth Development Coordinator, is not an expansion of services, but it is a slight repurposing of some existing dollars that were used for a similar function. But the RFP was done in a way that recognizes many of the recommendations of the young people, which is why I informed you about that research. So I'm going to turn it over to Nigel Perot, who is our Youth Development Coordinator, for the remainder of the presentation.
Thank you very much. Welcome, Mr. Perot.
Thank you, Mr. Chair. Thank you, rest of the committee. Thank you for allowing me to speak today. As Gretchen Musicant pointed out, our commissioner, that there's a significant need for sexual health services in the city of Minneapolis, specifically when we're looking at the needs of our young men of color. The next slide and this slide and the next slide represent the rates, or currently the cases of gonorrhea specific to both Minneapolis for youth ages 15 to 19 is that top rate, and then the bottom rate is 15 to 24 compared to the rest of the state of Minnesota. And on the next slide you see as well the rates of chlamydia. There's a significant issue as it comes to the rates of STIs in Minneapolis compared to the rest of the state of Minnesota. And that was one of the reasons that we were motivated to do this research about why are the rates and why are the disparities so great in Minnesota or Minneapolis compared to the rest of Minnesota. And when we further break that down to population in terms of race, you see here that the racial composition of youth in Minneapolis is primarily white youth, but when you look at the breakdown of chlamydia, which is that left bottom graphic, and gonorrhea, the right bottom graphic, that yellow represents African American youth in comparison to the rest of the state. So as you see, there's a very large disparity between the actual representation of youth within Minneapolis and the actual representation of youth that are have chlamydia and gonorrhea within the state of, or within Minneapolis. These disparities too, when we look further into the communities, oftentimes what you've probably seen here in different presentations to the committee is that the communities most impacted are near north, our Camden and our Phillips neighborhoods. So as Gretchen mentioned before, that the purpose of this RFP was to really take into consideration the recommendations made by the youth research as we redistribute this $85,000 to a new agency, as it was able to take in those considerations, specifically being able to work with primary stakeholders in the issue, engaging youth in authentic collaborations as it comes to coming up with solutions to address the barriers, and then also an increased investment in our young men of color when it comes to sexual health services within Minneapolis. Many of you are probably familiar with an RFP review process, but just to break down kind of what we received in within our RFP process is that we had 10 proposals totaling over $850,000. The services that were included within each of those proposals varied, including outreach, education, screening, and treatment. One of the things that Commissioner Musicant mentioned before is they're really looking at opportunities and other ways to address the issue and address the population outside of the clinical scope. Those that are most in need of these services oftentimes are not seeking services through clinical settings. So it was really important for us to really engage other and look at other opportunities for doing these kind of services in a non-clinical setting. Some of the populations and or some of the themes that came up through the proposals is really the inclusivity. So even though the primary focus of this money was on young men of color, there was a lot of kind of feedback as well from the youth researchers that we focus on doing some work around LGBT communities. So about half of our proposals had some sort of LGBTQ educational component with their proposals. Again, the need to think outside of the clinical services was something that came up a lot in our proposals, and out of the 10 proposals that we received, only 2 were actually clinical settings, so that gave us a really good opportunity to think about outside the box of where we're doing these services and how we do these services. And there was a lot of a lot of the proposals too, which was really I felt was important, was including youth in the solutions as either peer educators or some sort of peer advisory committee and doing the work and kind of being able to address what are the needs of youth and how do we use the voices of the youth to put together those solutions. Something else that I included in this process as a result of kind of the recommendations of the youth researchers, I really was important for me is also to have the youth that were involved in this process to be part of the RFP process as well. And so when we did our standard review process, the top 2 went to youth reviewers as well, and we were able to pull those youth reviewers from the Minneapolis Youth Congress, and they gave us a really good opportunity to think about these are the youth that are likely going to be utilizing the services, so they should have some sort of say or voice in those services as well. Again, to recognize that need to have that authentic engagement from youth as a recommendation of the Youth Pres research. So ultimately, we decided on the Pillsbury United Communities. The 3 kind of main focuses, or I should go, I'm going to step back a little bit, but ultimately kind of the conversations that came up through our review process is really looking at, are we filling the gap or are we addressing the gap? And when we talk about filling the gap, it's that we're just putting services out there for the purposes of providing services. We're addressing the gap is not only are we putting services out there to provide services, but we're also looking at what can we do to make sure that these rates go down and that we can work around some of those barriers and making sure that people have access to the sexual health services that they need. So we felt this came through a lot within Pillsbury United Communities proposal, and specifically some of the recommendations that they pulled as well that we included within the RFP as well. So as you see on here that they are including peer educators in their process, so really looking at the youth themselves as a method of providing the education and outreach and focusing on different areas within the city through their I think what was also important is that through the Pillsbury United Communities and the wide reach that they have, focusing on 3 different locations within their service area, which included the Pillsbury Theater, Waite House, and Oak Park. Again, meeting those different communities I identified before that have the highest rates. The other thing I like about the peer educators too, it really gives an opportunity for youth to look at the ability to kind of foray into different opportunities around employment as well. A multi-tier approach in the outreach, so not just focusing on in-person outreach, but also looking at online and social media as well as part of the outreach component. And again, where addressing the gap comes in is really looking at what the barriers that are in receiving services through the clinical setting and working with different clinicians within the city to address those barriers and kind of come up with a plan of action moving forward and how do we reduce those barriers. That is all I have for right now, and I, again, thank you all for giving me the opportunity, and if there's any questions, I'd be more than happy to answer them right now.
Thank you very much. Councilmember Bender has a question or comment.
Thank you, Mr. Chair. I wondered if you could talk a bit more about the background of this issue and why the health department has identified this as an issue in these particular infections as the ones that you're presenting about.
Thank you, Mr. Chair. Thank you, Councilmember Bender. Part of the reason and the rationale that we've been looking at these 2 is that the statistics themselves are really what's painting the picture of why this is such an issue. Again, going back to those last 2 slides in the beginning, you can see that our rates of gonorrhea and our rates in chlamydia within the city of Minneapolis compared to the rest of the state are staggeringly higher than Minnesota itself. That is one of those kind of opportunities that really looked at what is going on here, that there's such a high rate within our city compared to the rest of the state. Again, looking at the second or the third slide, looking at the different communities of color, you see again that there's a huge issue in terms of disparities when you're looking at the overall population of Minnesota is largely white, but then when you look at how and where those impacts are in terms of the chlamydia cases and the gonorrhea cases, you can see that there's a large impact on African American communities. And so that's really what motivated us to kind of do this research and move forward on this. And it really, I think with that youth prize research too that we're finalizing, it really does match a lot of what's happening at the national level in terms of research and really confirming that there is a need for looking at how sexual education is being provided and really thinking about other opportunities to make sure that it's the most impactful and the most helpful for youth as they move forward. And I think one of the things too that is really significant about some of these issues too is that there is a I think there's a lot of different kind of multiple variables that come into play as well. Is that there is a lack of consensus around addressing the needs of young men of color, and so really doing what we can in terms of what is the best approach and what is that messaging and how do we provide those services.
Thank you. I asked because, I remember the presentation from last year, and it was one of the most powerful things I've seen in my time on the council, just the way that the young men in the program were able to be empowered to speak for themselves and with their peers. And I thought there was value to the program that really far exceeded its specific target. But I wondered when my colleagues voted to cut the funding from the budget, I wondered if maybe folks didn't know kind of the seriousness of the impacts of these diseases on the day-to-day life of youth, or maybe didn't know why it had risen to the top as a priority. So as we go forward, I'm glad to see this program continuing. And I wondered if maybe there's a need for us to kind of highlight, of course, there's the overall narrative about the disparity, but just maybe more information about the kind of impacts of what it's like to have, what's the impact on the day-to-day life? Are youth missing school? Are they, what is the impact in the community of these diseases spreading in a disproportionate way in our community? But I just wanted to also just thank you for your work, because again, I thought that this was really one of the most powerful things that we saw in this very small, relatively speaking, program in the health department. So thank you.
Thank you.
Appreciate that. Councilmember Fry, did you have a comment or question as well?
Thank you. The statistics are very clear. Had a question. So these are set up on a per capita basis from rural areas versus city areas. So obviously, even though there is a higher density in city areas, it probably wouldn't account for everything just because it's done per capita. Do we have statistics showing a comparison of Minneapolis versus other cities and other cities versus their corresponding rural areas? So, I'm wondering if this is, if quite simply there are higher rates in all cities, or if it's just Minneapolis.
Thank you, Mr. Chair. Thank you, Councilmember Fry. I don't have immediate access to those statistics, but that's something that I can follow up with you afterwards in email if you'd like.
Thank you. I would be just interested. Yeah. Thank you.
Thank you very much. One of the things that I'm recalling, I believe, is we actually used to put some money into these efforts. Maybe it was 2011, 2000. It was a few years ago. That was when the Teenage Medical Center was still up and running. We had street outreach workers doing this. And if you look back to the cases of sexually transmitted diseases among young people then, it was lower. So when we quit funding it, when we quit working on it, when we quit doing any outreach, it started increasing again. So that was one of the most dramatic revelations that helped me say, yes, absolutely, we should fund this. So I really appreciate that we found a way to kind of repurpose some funding to put into this and address this critical problem. I'd also like to replace or try to get back some of the lost funding through the budget process and move to direct the health department staff to request up to $100,000 in 2016 rollover funds to support sexual health services for young people of color. And maybe then we can augment this. Obviously, if we had 10 groups applying, I don't know if all of their proposals were as good as this one, but probably there are some others that are interested. So if we had some more funding, we could probably do a lot more. So seeing no other comments, I'd like to move that staff direction and also to receive and file this presentation. Are there any questions or comments on the motion? All those in favor say aye.
Aye.
Any opposed say no. That motion carries, and thank you so much.
Thank you, Mr. Chair. Thank you, rest of the committee.
And that will move us to our last item on the agenda, which is the long-awaited I think, at least for me. Air Quality in Minneapolis report. This is a report from the extensive air quality research and program that we did in the city of Minneapolis for the last few years. And we're going to have Mr. Hanlon and Ms. Lansing do the presentation. Welcome. I'm going to take whatever time you need to get set up. There it is.
Thank you.
Thank you, Chair Gordon and council members. My name is Jenny Lansing. I'm the Senior Environmental Research Analyst with the Health Department and the Project Coordinator for the Air Quality in Minneapolis, a Neighborhood Approach Study. Today we're going to share with you the results of this study, and I will let Patrick lead things off.
Chair Gordon, council members, my name is Patrick Hanlon. I'm the Environmental Initiatives Manager with the Health Department. In describing Minneapolis within the context of regional air quality, there's always a balance in describing air quality in Minneapolis. On one hand, we have relatively clean air, and especially when you compare it to a lot of other major metropolitan areas, we have good air quality. On the other hand, there was a life and breath report put out by the Minnesota Pollution Control Agency and the Minnesota Department of Health a couple years ago. And in that report, it attributed air pollution contributed to 2,000 deaths, 400 hospitalizations, and 600 emergency room visits in the Twin Cities in 2008 annually. And our air quality today isn't significantly different than it was in 2008. So there are far too many air quality related fatalities, and we have a lot of room as a region to do better. Another issue to keep in mind as we describe the results of this study today is that this is just one piece of a larger puzzle. There are many ways to look at air quality and the different pollutants that contribute to poor air quality. The volatile organic compounds we analyzed in this study give us one piece of that larger air quality puzzle. So how is this study different than the other pieces of the puzzle? Is when you look at regional air quality data, typically air quality is examined on a regional, continuous manner, high on buildings that are miles apart. They analyze the soup of air quality, the pollution burden that everyone, everywhere across the region is exposed to. Versus this study, where we took 8 snapshots of air quality over 2 years where people work, play, and live, a neighborhood approach. And then why did we choose volatile organic compounds as the piece of the puzzle that we looked at? Volatile organic compounds contribute to ground level ozone in our regional air quality, and repeated exposure to ground level ozone can aggravate pre-existing respiratory diseases such as asthma. Volatile organic compounds have something we call speciation, is another reason we chose them. And that's a way that we can look at individual chemicals and determine individual sources. So through determining those sources, we can drive towards solutions. Analyzing VOCs gives us the ability to drive towards solutions. So these are the sampling locations that we took during this study. We studied 62 different volatile organic compounds, and excuse me one second. 62 different volatile organic compounds in the study, 100 locations across Minneapolis, and this is the sampler that we use. It's called a SUMA canister. It uses an Environmental Protection Agency TO15 sampling method, which is to say it's a scientifically certified method of sampling. We realized we would need to set out over 100 samplers evenly across the city as you look at this map, turn them on at exactly the same time, wait 72 hours, and then turn them off at exactly the same time, or relatively the same time. We laid out our methodology, and when we sat around a table, there were 5 of us. The logistics seemed overwhelming. No other city in the U.S. had taken on a sampling project of the scope and size for us to follow a design method. Jenny Lansing, the coordinator of this study, immediately found volunteers from the office and then reached out across the city of Minneapolis to staff and then reached out into our communities. Sampling at this level would not have been possible without the help of 130 volunteers that helped us put this study together. And I don't know if there were people that volunteered for the study in the room, but we have some people that helped with that. So thank you very much. And I know that there's some people watching on their computers and at home as well. And so thank you very much. This study would not have been possible without that help. And a special thank you to Jenny Lansing for her scientific expertise, relationship building with partners, and diligence in training and communicating with those 130 volunteers. It was a massive undertaking on top of her regular duties. A big thank you to Jim Doughton for his technical expertise on the project as well. So the summary of the results, air quality in Minneapolis and neighborhood approach. Overall, it's similar to how you look at regional air quality. Overall, we have relatively clean air. There were hundreds of these samples that came back with no hits over health benchmarks. Similar to regional air quality, we have areas for potential health concern. We have similar data. We picked up similar data to regional air quality monitoring for benzene and formaldehyde. Benzene and formaldehyde are routinely found over health benchmarks in regional air quality, and we found a number of samples across the city that were over health benchmarks in Minneapolis as well.
So can I just ask a question about the map? Because I noticed there were triangles that say formaldehyde. Were those the full canisters that were used on those, or did we do a different testing right along, it looks like along some of our commercial corridors and that? So
that's a great question. Yeah. So 61 of the volatile organic compounds we did using the SUMA canisters, and the formaldehyde, we did transects of roadways using badges. And so, yeah, it was a different sampling methodology and looking at formaldehyde related to transportation. So that's a great question. Thank you. And then in the study, we found surprising levels of tetrachloroethylene across the city, commonly called PERC, and most often used in the dry cleaning industry. We need further study for hits of trichloroethylene and naphthalene that we found over health benchmarks in this study, and Jenny will go through some of this data. When we look at air quality related to this study, when we look at health concerns related to this study, we look at the health concerns in three ways. One is through worker exposure. Two is where this study took place in the neighborhood exposure. And then three is through regional air quality. And when I say worker exposure, because if we find a sample in a neighborhood, we know if we know the source of where that sample came from, where that hit came from, we know that the workers are oftentimes exposed to hundreds of times greater amounts of that chemical than what was found in the neighborhood. And so that's why it's our primary health concern. Example would be if we found a sample of 50 micrograms per cubic meter in the neighborhood of PERC, we may find, as we have found, 87,000 micrograms per cubic meter of PERC in U.S. cleaners, 24,000 to 32,000 micrograms per cubic meter in a dry cleaner that we recently switched out, Elite cleaners. And just keep in mind that the health benchmark for PERC is 2 micrograms. And so when we find those hits in the neighborhood, it relates to what workers might be exposed to in the sources of the pollutant. And then the second way that we look at health concerns is through the neighborhood exposure, is what are people exposed to on top of the different burdens that they have. This one specifically is looking at what the volatile organic compounds people might be exposed to in Minneapolis. And then we're also testing models. So the Minnesota Pollution Control Agency has a program called MinRisk, where they model cancer risks or hazardous risks to people's health. And in this study, we want to know, do those emissions actually get out into the neighborhood, and do they follow some of the models that are out there? And then the third way that we look at health related to the study is regional air quality. I mentioned ground level ozone before. These are the ground level ozone days over Minneapolis Health benchmark targets. And the volatile organic compounds that we had in this study contribute to that ground level ozone issue. The sources of volatile organic compounds, we know the main categories of volatile organic compounds. Most come from